Positive Community Care Limited enforces that all staff be first aid trained so that they are fully equipped if an emergency situation should arise. This video will train you in the basics of CPR. If patients have hurt themselves, it will be your role as the nurse to identify the injury and treat the patient adequately. CPR stands for cardiopulmonary resuscitation and is the basic survival technique applied in a life-threatening situation. Once the patient has been found, remain calm and check the surrounding area for any hazardous objects or situations. Your safety is still the most important. Once the area has been cleared of any dangers and is now safe, approach the patient calmly, speak to them and await a reply.
Can I have some help, please? Can you hear me? Can you hear me at all?
If the patient gives a reply, then ask the patient what has happened, where they're injured and if they suffer from any medical conditions. If necessary, shout for 999. If the patient is diabetic or epileptic, they will have in them a symbol which looks like this, showing that they are either diabetic or epileptic. Refrain from moving the subject in case there are any unobvious injuries to the spine that the subject is unaware of. If there is no reply from the emergency shout, assume that one has not been called and proceed to call the emergency services yourself.
Can someone get me an ambulance, please?
Remember to keep calm, as you have to remain by the side of the subject to monitor them. In the situation that the subject does not reply, place your ear closely to the lips and see whether you can hear or feel them breathing. In the event that you can hear or feel them breathing, if possible, check for any spinal injuries by running your finger gently down the subject's spine. If there is no sustained damage to the spine, proceed to place them in the recovery position and then call for the emergency services. To put the patient in the recovery position, fully extend the right arm with the palm facing upwards. Place the left hand of the patient on the cheek and with the palm facing outwards. Fully extend both legs and bend the knee of the left leg, placing the base of the foot on the floor. Now come around to the right side of the body. Proceed to pull the patient into the recovery position, placing one hand on the elbow and the other on the bent knee. To ensure the patient carries on breathing, you need to keep the airways open. To achieve this, place one hand on the forehead of the patient and two fingers under the chin. Tilt the head back and again place your ear to the lips of the patient to ensure there are no breathing blockages. Now call for the emergency services. In the event that you hear or feel no breathing, you must continue to perform CPR. In the event of drowning or suffocation, proceed to commence CPR immediately and then call for emergency services. However, in any other situation, shout for emergency services to be called first, then begin to perform CPR until they arrive. Place your left hand over your right hand and lock your fingers. Place your hands directly in the middle of the chest bone and keep your arms straight and lock your elbows to avoid exhaustion. You must always compress on the hips, not your arms. Proceed to give 30 chest compressions, aim for approximately 1.5 to 2 inches down on the chest. You must continue these compressions until the emergency services arrive, whilst alternatively applying 2 rescue breaths in between each set of 30 chest compressions. Tilt the head back, placing one hand on the forehead and 2 fingers under the chin, and give 2 sharp breaths into the mouth of the patient. Repeat alternation between chest compressions and rescue breaths until the emergency services arrive.